You're listening to Parenting Our Future with certified parent coach Robbin McManne, author of The Yelling Cure and founder of Parenting for Connection. My podcast is all about providing you with the tools and solutions you need in your parenting so you can create the family you always wanted. Hey everybody, it's Robbin McManne here. Welcome back to Parenting Our Future. And today we're talking about a really important subject, one that I haven't really tackled yet on the podcast. So I have Dr. Mary Barbera here, and she kind of fell into the world of autism in the late 1990s when her firstborn son, Lucas, started showing signs of autism. Fast forward to today, he's 24 years old, and Mary is now an award-winning international speaker, a podcaster, an online course creator, an author, and her mission is to help parents and professionals turn autism, or the signs of autism, around for millions of children around the world. And she's really here to talk about a really important book that is about to launch at the end of March 2021. It's called Turn Autism Around, an action guide for parents of young children with early signs of autism. I love this, Mary. Thank you so much for being here.
Thank you, Robbin. It's a pleasure.
And I really love that it's an action guide. You know, I think there's so many books that are like, okay, well, this is what it's all about. Off you go. But it's like, tell me what to do, right? This is the what, but I need the how. So I am excited about, this conversation. And, for me, I know it's long overdue. So if you wouldn't mind, let's start at the beginning. You talk about your son, Lucas, who is now 24 years old. What was your journey like? Because it must have been life-changing for you to really course correct your own life to focus on this specialty.
Yeah, so I had a master's degree in nursing, married to a physician, had both my kids, Lucas and then Spencer, 18 months apart. Wow. At the time I was a stay-at-home mom. I figured, I would raise my kids for a few years and then I would probably go back and earn a PhD and go back into the nursing field where I was doing research and I was a nurse manager and really trying to move that whole field forward. But when Spencer was born, it was the winter of 1997. And in early 1998, I took Spencer to a well visit, a 2-month well visit. And my husband said, when you go there with Spencer, ask the doctor how many words Lucas should have. So I did. And I said to the doctor, who was the pediatrician for both the kids, okay, Spencer's fine. How many words should Lucas have? And I remember him saying 25 words, and Lucas was 21 months of age. So I get back to my husband and he says, okay, how'd the visit go? And I said, fine. And he said, and how many words should Lucas have? And he said, I said, oh, he has 20, he should have 25. And so my husband's like, well, he doesn't have 25. Well, so in the car on the way home, I am counting every word I have heard in the last 3 months. I'm counting, well, he kind of regressed with some skills. So he used to say hi. So I'm counting hi. He even had this little script, like we'd take him to the park. And then in the middle of the night, it's actually called delayed echolalia, but it's scripting. So we'd take him to the park and my husband would read, please do not feed the ducks. And he would add quack, quack. So Lucas would wake up and say, please do not feed the ducks, quack, quack. I was counting those words, please do not feed the ducks, quack, quack, as 8 of his bona fide 25 words. So I said, no, I was counting E-I-E-I-O as 5 more words. Like literally like grasping at straws, not even thinking autism. I mean, I was just like trying to make my husband be quiet. And
as we do,
and trying to make it okay, that it was all right.
You were freaked out is what you're saying. You were freaked out.
Well, I wasn't freaked out until my husband then said, so you don't think Lucas has autism? And I can still remember like sitting in my family room of my old house with my 2 boys. And I'm like, what are you talking about? Like, I had watched Rain Man And as a nursing clinical rotation, I had gone to a residential placement, and some of the teenagers there had autism, and it didn't look pretty, residential teens
I'm
in
sure.
the 1980s. It was really scary to me as a nursing student. So I basically freaked out. I told my husband he was wrong. Like, I had never even thought that there was anything wrong, let alone autism. And I thought, what's the point of, there's nothing we could do if it was. So, hopefully it'll just get better. Do not ever, I never want to hear the word autism again, ever, out of your
So
mouth.
he
I said,
really, on his own, had his own suspicions, but you were totally clueless and a stay-at-home mom. So you were with him all the time and no
yeah.
clue.
And then I had a new baby.
Right.
And
Well, that's,
see,
there you go.
the thing about my husband is he's a physician. He's an emergency medicine physician.
Right.
And so what his big concern wasn't really the language. It was the fact that Lucas was 18 months when Spencer was born, and he was completely clueless, like mommy's big belly, nothing. Like, we could have literally brought a plastic baby doll home and it would have been the same.
Really.
So there was that really lack of awareness. And so basically I shut down, and he didn't bring it up again. We enrolled Lucas in typical preschool when he was 2. He was a summer birthday, so he turned 2 in the summer. He started in September. We got speech therapy started. Didn't really talk about autism, and the rate back then was 1 in 500. Now it's about 1 in 50. And 1 in 6 children also have some kind of developmental disorder at the age of 8. They either have 1 in 6, autism, ADHD, learning disabilities, speech disorders, cerebral palsy. Those are all encompassed 1 in every 6. And so
1 in every 6 kids
yes,
has
this is a
sorry, how did you say that? A developmental
disorder, including autism, ADHD, learning disorders, speech disorders. At age 8, this is a CDC stat. And then 1 in 50 have autism now. And so it's very frequent.
Okay, and so I don't want to get into the weeds about it, but what is the reason it's gone from 1 in 500 to 1 in 50? Is it just we're better at recognizing it?
We are better at recognizing it. That is some of it. Environmental triggers. It is highly genetic too. And it's a combination, just like breast cancer has exploded. There's a strong genetic component to breast cancer, but there's got to be a lot of environmental triggers as well. And then when you're talking about the range of the spectrum, I mean, a lot of people say, well, the spectrum is so wide. The DSM-5 is now in play. That's how you would diagnose autism. The DSM-4 was in play when Lucas was diagnosed. So, I mean, there's a lot of moving parts. But the thing I've learned over the years, finally, by the time Lucas was 2.5, 2 3/4, the preschool was calling us in. He's kind of in his own world. We're worried about him going to the 3-year-old class. You have to be potty trained to get to the 3-year-old class. The student to teacher ratios get worse. He's not aggressive. He's not doing anything harmful. He's just not talking. At that point, I'm like trying to get him to say ball, which I had no idea how to get him to talk. He had words, but I had no idea how to get more words. Now I absolutely know. And kids were coming out going, can I go over to Johnny's house and play? And I'm trying to get him to say ball. And so as you wait and worry,
right,
the situation gets worse. And so the day before his 3rd birthday, he was diagnosed with moderate to severe autism. And a couple months before that, I had read a book about applied behavior analysis treatment. and that was and still is the most scientifically validated treatment for children with autism, and it's intensive therapy. Um, and so I found this therapy, and even some of the really classic studies done in the late 80s and 90s that showed that kids could actually become quote unquote indistinguishable from their peers. And I know the term recovery is really controversial,
Button. Yeah.
triggering for a lot of people, but that's what these early studies showed with applied behavior analysis, is that kids could do a lot better. And kids that I've cared for now as a behavior analyst, they're in college, they're driving, so whatever indistinguishable recovery looks like, some kids do really, really well.
Right.
And that but because we waited so long, because of my denial mostly, and then we got in a little waiting list situation. But Lucas was diagnosed the day before he was 3, and then I was like, well, what about indistinguishable? What about recovery? And what about ABA? And the doctor was like, yes, you need to do ABA, because that is what we do,
Right.
what we recommend. But he didn't say it specifically, but he pretty much said, in my head, if you would have brought him in as soon as your husband mentioned it, and you would have gotten on this at 21 months instead of 36 months, he could have had a better shot.
My gosh.
And so then I was like extra guilty.
Yeah.
Right. And so anyway, we got him into applied behavior analysis treatment, 40 hours per week for a 3-year-old. That's 8 hours per day, 5 days a week therapy. Depending on the state you lived in, people were mortgaging their houses and stuff. But in Pennsylvania, where I live, there was another kind of loophole situation, so that Lucas could go on medical assistance and he could get this kind of treatment without us going into debt. But anyway, fast forward, I became a board certified behavior analyst. I was a big part of this big grant through Pennsylvania called the Pennsylvania Verbal Behavior Project. I ended up writing my book, The Verbal Behavior Approach, speaking all over the world about autism.
Wow.
And then I was like, all right, I got a PhD then. And I was just like, people are like, well, what are you going to do now? I said, you have a PhD. This is a decade ago in 2011. I was like, well, I'm just going to keep going door to door, playing potato head with my little clients and speaking around the world until I can figure out what to do, until I figure out how to get my message online. Because I knew door to door was not efficient, and I knew flying all over the world was not efficient in terms of getting my word out. So fast forward, I became basically an online marketer. I joined Jeff Walker's launch program, and so now for the past 6 years, I've been I produce and sell online courses for parents and professionals. And my newest course is been around for a couple of years. It's the toddler preschooler course, and I'm getting parents in there. A lot of parents, half the parents, don't even have a diagnosis for their kids now, because now with the rate of being 1 in 50, now parents are, even if they're not in denial, the wait list for evaluations and treatment are just horrendous, like 9 months to 2 years.
Well, let's sort of stop there for a second, because what I want to do is I want to look at, and I'm sorry, I don't want to interrupt you, but I want to look at, we're talking 1 in 50, and as a mom, and as a, I think back to, this was your first child. I know you had another one right away, but look, we can be really hypersensitive to what's going on. We can either draw the wrong conclusion. I mean, how many doctor's visits did I have when my son just had diarrhea when he was a baby? You know what I mean? Like, so some parents either, can be, really pragmatic. Others can, be extra sensitive, others, whatever. You get what I'm saying? So let's just talk about what the early signs are, whether they're autism or not. What you're saying is there's still things you can do that even if you don't have a diagnosis, that will help your child along regardless of whether they have autism or not, because we're still looking at 1 in 6 having developmental disorders, and this will help them too, right?
Right,
Even if they're
right.
a typical child, you've not wasted anything.
These are
Right?
really good engagement strategies
Yeah.
for parents and grandparents. We have lots of grandmothers in our online courses as well. So basically the signs are, and I didn't know these signs as a nurse. I didn't know it was my responsibility to print off or look at developmental checklists or anything. I was just like, I was more like you, worried about like if any diarrhea or cough or from a medical model. I wasn't looking at development. So a speech delay is very common. So whether that's a very young child, and my new book is for parents of 1 to 5-year-olds with autism or signs of autism, which are also signs of ADHD, signs of learning
Yeah.
disorders, signs of speech delays. So speech delay, whether it's not talking or like have what I call pop out words, like they have words, but you don't know how to get more words. Um, so, but it shouldn't require effort to teach kids to talk. Um,
Right.
but
They're
with
like sponges, right? There's
they
like a
should
word
be,
A. Yeah.
but if they're not, if you're like, ball and the other kids, your child's age are speaking in full sentences, then there's probably a disconnect. But even earlier than that, before age 1, when you should be getting some words, some single words, before age 1, you also have to look at like babbling. You have to look at eye contact, but like looking at faces, smiles, giggles when the parent is trying to do something, babbling, and then babbling words and getting baba versus mama and dada. And then early imitation, like making raspberries with your face, and then the child makes raspberries. Like those are all what we call joint attention. And that's really what goes off track with kids that end up with a diagnosis of autism. They actually lose that back and forth. It just gets off track. And all of a sudden, kids can also regress. And like
Right.
Lucas, he was waving and he was pointing and then he stopped. And some kids have a very severe regression where it's like one day they're not doing things. But I was pregnant, I was a first time mom, so it was like he became a pickier eater. Now he was crying for this. He was, the cute little sing-songy things that we used to do, he wasn't doing them anymore. So then it was like, well, is it a phase? I don't know. So
Right.
depending on the age, like whether you're worried about 8-month-old versus you're worried about a 3-year-old. Now, a 3-year-old should be forming sentences and that sort of thing. So we could, just because your child's talking doesn't mean they don't have autism either, because there's talking is only one piece of the puzzle. The social communication, play, pretend play, shared play, shared communication, shared negotiation. So communication, social communication specifically. And then the other big thing is repetitive or restricted interests. But not every, gifted children have restricted and repetitive interests.
Yeah.
My typical son, Spencer, was really obsessed with trains. And I was worried, kids also, a really big thing when you are 15 to 18 months of age is you really need to point with your index finger to indicate not only what you want, but things in the sky to get your parents' attention to look up at the sky. And that's another signal of joint attention, where I want your attention to look at the airplane and I'm pointing, I'm looking at you, that social referencing. So it sounds complicated in some ways. It's pretty simple in other ways, but it depends on your child's age. And so in my book, I talk about all these signs.
Yeah.
And then I refer people to the CDC Act Early website, which you can print out and you can look at. 4 months of age, they should be doing this. And like I say in my book, it's like if you have a 2-year-old and they are only meeting the 18-month milestones, but it's pretty clear across the board, that's probably just a little bit of a delay. But if you're looking at a 2-year-old and they are in some areas meeting a 9-month-old level or a 12-month-old level or a 3-month-old level for some areas, then you're talking about huge differences. And that's why, another reason you have to really act early, because if I would have gotten on it when my husband first mentioned it at 21 months, Lucas would have been at a 9 to 12-month-old level of language. But that's where he was when he was 3.
Right.
He was still back at the 9 to 12-month-old level.
So would he have continued to progress had you caught it early?
If I would know what I know now,
Right. Yeah.
I don't even know if he would, I mean, I just know so much. I mean, even just talking is one thing, but receptive language is another thing, like following directions to do things, following directions to touch your body parts, just being aware that mommy's having a baby and now this baby is coming home and this baby cries, and watch changed diapers. I mean, there's just so many skills that typical kids develop naturally that kids on the spectrum, especially on the severe end of the spectrum, are very delayed with.
So, so is it a lost cause if you miss the opportunity in those younger years? Because you said to me that it's never too late on one hand, but on the other hand, you also said to me that most kids with autism are operating at a certain age level, right?
It's such a huge spectrum. It's autism spectrum disorder. So we go from very severe, needing no language ability,
Okay.
not toilet trained, not, able to do much, to on the other end of the spectrum, depending on the age, kids going to college, kids driving, and having just subtle differences. So it's never too early to put these strategies in place. And my book is really for kids who are 1 to 5, either real chronologic age or have some deficits that are 1 to 5-year-old level, and or have issues with problem behaviors, potty training, eating, sleeping through the night in their own bed, going to the doctor's, dentist, haircuts, and having problem behaviors. So my book is a step-by-step guide for all of these things.
Right.
And really, it's hard because my first book, I talked to like anybody under the sun, parents, professionals, toddlers, routines, low end of the spectrum versus high, but even that book is, my focus is really, I specialize in kids that are not conversational. So those kids that are going to college and everything, I mean, I can give general strategies because I'm a behavior analyst and I'm a mom and I have a typical son, and I know the science of applied behavior analysis can be applied to everybody, even all of us, typical adults.
Yeah, I think what the point I really want to make is that what you can do with catching it early and using the applied behavior analysis is that it's not necessarily going to take your child off the spectrum, but it's going to help them really live like the best life they can live, right? And so you're really stopping the slide back. Right? Is that what you're saying? Yeah. You're stopping the slide backwards, and you're helping them to stay at and also grow and develop as much as they can, even if they stay at a grade 5 level, let's say hypothetically, right? Even if they stay at a grade 5 level for most things, it could have been worse if you didn't do it. That's what you're saying?
Well, I think we're all trying to improve ourselves, and Yeah, my goal for every child, whether it's my son Lucas with autism or my son Spencer, who's now in medical school, is for both my kids, all my clients, all of your kids, if you're listening, to be as safe as possible. And so safety for Lucas and Spencer looks different. I mean, Spencer flies in planes and stuff, but we still talk about safety. I mean, that's the number one thing, right? How are you going to be safe? Safe, as independent as possible, and as happy as possible. And
Mhm.
so that each child reaches their fullest potential and continues. I mean, that's not a static thing where you reach your fullest potential. And that, we as parents only have one life too. So, it's very common, especially for moms in the autism world, to get so ingrained with everything and just throw themselves into it 24/7 like I did. Like it is ironic that I told my husband I never want to hear the word autism again, and now I say it, speak it, write it, type it like
Yeah.
zillions of times a day. But we only have one life too.
Mhm.
And so we also want to be happy. And so I know, and there may be listeners out there that have heard bad things about applied behavior analysis, that, you know, there was in the earlier um, renditions of applied behavior analysis treatment for kids with autism, there was more, punishment and that sort of thing. My approach, because I'm a mom, I'm a registered nurse, I'm a behavior analyst, I believe in a really child-friendly approach. I don't want crying. I don't recommend crying it out. I don't recommend keeping the demand on. I recommend if a child's crying, we have to figure out why he's crying. There's obviously missing some prerequisite skills. We don't have enough reinforcement. We don't have, we just have to think about, okay, this crying is not an option. And that, a lot of parenting sites and groups, there's actually what I would consider some bad advice going on from other parents who, have been told, let them cry it out, or they just have
Right.
to learn. Like that is not my way at all.
So what exactly is applied behavioral? And I keep forgetting the extra A, the applied behavioral analysis.
It's
Is it
applied behavior analysis. It is confusing. So applied behavior analysis is a science. It's the science of changing socially significant behavior. So
right?
the science, when people say, oh, I don't like ABA, or we tried ABA, it doesn't work, it's like, to me, applied behavior analysis and is a science. So that you saying ABA doesn't work is like saying gravity doesn't work.
Right.
If you reinforce a behavior, it will go up. And it's learning theory, it's gaming, how to, you hear a noise when you get a correct response. It's all of that is ABA. It's the
Okay.
science of, the fact that your listeners are listening right now, they wouldn't be listening if they weren't interested, if this was not reinforcing information.
Mhm.
You wouldn't go to get a job and unless you were going to get paid. Like that's reinforcement. Like people are like, oh, I don't believe in rewards. Well, we're all operating in a state
Yes.
of reinforcement.
And
Otherwise
so
we
that's
would
it.
not be
If you
doing
boil it
anything.
down into its simplest forms, is that what it is? I mean, for
Yeah.
anybody, like for somebody who has never heard that term before,
Mhm.
like how do you say it? And I know you live and breathe this, but how do you say this in the most simplest forms? And then what does it look like practically if you're trying to teach your child to speak?
Yeah. So, and there's actually a two-part answer. First, applied behavior analysis is a science of changing
Okay.
behavior. So that
Okay.
that is something that's like steeped in science. There's
Got it.
not any argument. However, where the controversy comes in is in the 80s and really in the 70s and the 60s too, but mostly in the 80s, applied behavior analysis is also a treatment package for kids with autism. And
Okay.
that's where you take the science and you make a treatment package. And my treatment package is also based on my nursing background, my mom background, my advocate background, my
Mhm.
marketing background. Because I have to break things down even simpler because, not everybody's going to have 20, 30 years of experience as a nurse and a
Exactly.
behavior analyst.
Exactly why I'm asking, because like dumb it
so
down for me.
yeah. So basically with any kind of applied behavior analysis treatment package is we break things down into steps so that a child that can't speak at all, we can they babble? Do they say anything? Can we even get them to say ah versus that's a big start, because if we can get a discrimination between the two, or a child who is speaking but doesn't know colors, for instance, like how should we teach one color at a time, or should we teach three colors? Should we teach them to touch the colors, or should we teach them to say the colors? Should we teach them to match colors? So it gets really complicated.
Gotcha. Okay.
And not all ABA is created equal. I am a board certified behavior analyst, and I was among the first 1,200 board certified behavior analysts. It just started basically 20 years ago in 2000. But there's 40,000 behavior analysts. And there's many, many other people. Now, I was saying before, like people had to mortgage their houses and stuff to pay for this. But now ABA treatment, applied behavior analysis treatment for kids with autism, is covered in all 50 states.
Wow.
So now people start hearing more about this.
You can get the
and
help.
So now ABA is really known as the treatment for kids with autism. But as I outlined in my book, breaking these steps down is just a very good parenting model. Okay, so there's 4 steps to the Turn Autism Around approach: assessment, planning, teaching or intervening in some way, and then evaluating with easy data. And that is the scientific method. So if you have a sleep problem, we need to assess how old they are, what their general ability level is, and then what's the problem with sleep? Not falling asleep, not staying in their bed through the night, banging their head on the pillow or on the bedboard or whatever. But we have to take it systematically. So basically, it's just a systematic way of teaching any skill.
And breaking it down as small as you need to, based on where the child is at. Okay, I think I get that better.
And to have a lot of reinforcement going. So that has to be planned, because a lot of kids that aren't talking, they haven't learned it naturally, need a lot more reinforcement than you would think.
Okay. So that's so really what we're talking about is the science of, like really encouraging them, teaching them, boiling it down to the very basic. And you can't really define what it's going to be like as an umbrella statement, really, because it's so individual to the child and where they are. But it in and of itself is really breaking down, like sleep. Like, let's look at all the reasons why, what exactly is going on. Like, let's get the whole picture. And then from there, we put a plan in place. Got it. Okay, good. Okay, good. And so what you're saying is also is that, yes, that ABA is available in all 50 states. And as a Canadian, I know that it's available here too. However, there are tremendous amounts of wait lists, because there are 1 in 50, 1 in 6 that could be suspected. And like you say, the 1 in 6 could be ADHD or learning, disabilities, those sorts of things. So it is in parents' best interests to really take this on their own as best they can, because within the waiting time, there is a slide back. Could be a slide back, most probably will be a slide backwards. And so, like, let's just keep it going as best as we can, based on your own bandwidth as a parent too, because this is a lot of pressure and a lot of stress, for parents too. But that's essentially what you're saying. And that's the book that you've written, which is like amazing.
Thank you. Yeah, it was a labor of love. Turn Autism Around is the title of the book, and um, it's available for pre-order. It's coming out in late March, in time for Autism Awareness Month, which is April. But I really want to stress that even if you don't have a child with autism, if you have a child with any kind of issues, speech delays or attention issues, or you just think they're a little behind, or you have a nephew with autism, or you have another child with autism, or you just want to learn good techniques for solving picky eating or reducing
Yeah.
tantrums. That's the other thing, is applied behavior analysis treatment looks at increasing all the good behaviors you want, talking, all those behaviors we talked about, while reducing any problem behaviors.
Right.
So it's that scale of the reason they're not learning is because they usually have either some tantrums that are just out of control that aren't gonna go away just based on what you did with your last child. And then, or they may have some like really repetitive interests that it's hard to like break in.
Okay,
So
can I
I had,
ask you,
yeah,
would
sure.
you be able to give me a couple of sound bites, if you will, on just to help parents? Because look, every parent that's listening is here listening because they most probably have a child on the spectrum or they suspect that they do. So let's say we've talked about the early signs. Let's say you've got a child who's really prone to meltdowns. You know, what can you say, you know, sort of quickly, because you know, we're almost out of time. What could you say quickly that would help a parent immediately help with it, with a meltdown or a tantrum? I use the word interchangeably.
Yeah. So that's a great question. And I'm a behavior analyst. So reducing tantrums and reducing problem behaviors is what I do.
Okay.
And it has nothing to do with autism, really.
Right.
I mean, even for adults, you know, basically we have a couple reasons why people have problem behaviors. And
Right.
there's four functions or whys of problem
Okay.
behaviors. So there's the child could have a medical issue and be crying or having problem behaviors related to that. Most people don't talk about that very much because they're assuming that everything's fine. But as a nurse and a behavior analyst, I think we need whole lot more research on that. And I know my own son, when he was a teenager, got some pretty severe problem behaviors, and it was related to a medical condition, and now he's completely stable. And I did a
Wow.
podcast with his psychiatrist, and the psychiatrist put him on a cardiac med that solved his autonomic nervous system function, which sounds like that could be like a whole, you know, show on its own, but
Yeah.
it is so confusing. So medical issues are real. If your
Mhm.
child's having diarrhea, and you know, they might not be able to tell you my belly hurts either, but
Mhm.
you know, so medical issues are big. And
Okay.
especially if it's an acute tantrum, like all of a sudden your child is crying, you know,
Mm.
I would rule out ear infection, and you
Oh,
know, really think about, are their stools normal, and those sorts of things. So medical issues are big.
okay.
And then there are two big functions that we see all the time in schools and homes. And one is that a child will cry because they want something, and they either don't know how to ask for it, don't know how to ask for it the right way, or you're telling them no and they want it. Okay, so you think the classic story of the kid in the grocery aisle, you know, with
Right.
the wanting the candy, and now you're dropping to the ground and crying because you're not giving them the candy.
Right.
So that is one area
Mhm.
why kids have fits. And then the other reason why tantrums happen is when kids are told to do something they don't want to do, like take a bath, or time to go on Zoom for homeschooling, and or put your coat on, or put your shoes on, or clean up your room. So that those two functions are really what we see all day long, and a lot of times it can be combined. during
Right.
transitions. All done your gaming system, time to do your homework. Now we've actually inadvertently given a demand to stop a preferred activity, and
Mhm.
we also placed another demand. And then we wonder why kids have such a hard time transitioning from high preferred to low preferred.
Right. Oh, yeah.
And so I talk a lot about that in my chapter on reducing problem behaviors, but basically transitioning, give warnings, dangle the carrot before problem behaviors occur. Don't have them go from a 10 on their reinforcement scale to a 1. So instead of having their most preferred thing and their least preferred thing, you want to like, okay, let's you're going to give transition warning. Okay, 5 more minutes to your game, and then we're going to have a snack, which is on a scale of 1 to 10 isn't a 2, it's a 9 or an
Right.
8. So
Right.
then it's like you've given a warning, you've even sometimes just set a timer, like depending on if a child has the ability to comprehend what you're saying. So in general, basically, we go through the 4 steps of the Turn Autism Around approach. We assess, okay, what's the problem? If it's a severe problem, like they're aggressive or self-injurious or property destruction, obviously that's more important to tackle than whining. So there's degrees. So we
Yeah,
go
of
through
course.
assessment. We look at not just the problem behaviors, but when it occurs, why it occurs, and is there also this huge language gap? Like, do they not understand the world around them? Then
Mhm.
you're going to have to actually put your plan in place to treat them really more like somebody a lot younger. So you wouldn't
Mhm.
be giving all these verbal directions to, transition, and you just have to calm the situation down by coming up with your assessment. You know, you may have like 100 different problems you want to tackle at the same time. And that's why in my book, I have a 1-page assessment that's going to be available as a book resource. Like many resources within the book are also going to be available for free at turnautismaround.com. But the 1-page assessment looks at the whole picture very quickly in 10 minutes so that we're
Mhm.
not dealing with sleep when really the issue is self-injurious behavior during eating,
Mhm.
or
So,
whatever.
yeah. So, okay. So really what I heard you say is, in terms of stopping, a meltdown or a tantrum, we're looking at what is the underlying reason why, right? And it's, what I always tell parents is like, you take the behavior and you just put it aside for a minute, right? Because we need to get underneath what's really going on. And you're saying it's either a medical reason that they want something that they either can't ask for, or they want something they can't have, or you're asking them to do something that they don't want. And what you're really saying is, okay, look, if we're going to transition kids and we want to stop a meltdown before it happens, and we want to say, hey, stop eating that ice cream so that you can now eat your broccoli, is really not good, because ice cream is high on a preferred activity versus broccoli, which is the lowest of low for a lot of kids, right?
Yeah.
So you want to say, like you can't have any more ice cream, but here's what an
Yeah.
apple or
Yeah.
something
Yeah.
sweet and still yummy, whatever. So you're really trying to keep it into the favorable kind of category. And the thing is really what parents need, because we get so overwhelmed, because we're so tired, we're so confused, is we need to know those things, and we need to not just know the what, we need to know the how. And really that's what you've provided is
And
in your book, right?
one thing that I didn't say that I absolutely need to say is with problem behaviors, we want to spend 95% of our time preventing them by doing all
Yes, I
this
love
back
it.
end work.
Yes.
95% of your time preventing problem behaviors, because once he starts the meltdown at the grocery store, it's not a win-win situation.
Yeah,
um
I totally
and
agree.
so we have to be proactive, we have to plan, and we have to plan it all together. And that's why my book and my online courses are preventative. So we're looking at a snapshot of a one-page assessment you can do in 10 minutes. We have a one-page plan we can do it in 10 minutes based on the child's strengths and needs and age and family priorities. And then we start tackling things. And so with the grocery store idea is you may have to have a plan. Like, I know when I was a little kid, my mom would get me a box of animal crackers at the start of the trip and I would eat them the whole way. Or, she would let me eat them. That's just a preventative strategy. You could decide, like, every time when you come home from the grocery store, they get to access their iPad for 15 minutes. And that's the problem, especially during this age of COVID where, people are just really struggling with how much free access to all these iPads and electronics and, kids and families are, but think about preventative. Don't think about, like, I've got to buy my child something every trip. Think about things you have at home that could be kind of quarantined in terms of keeping them special for after you get home, you get to do this.
Yeah, I love that. And honestly, it really reinforces what I say to the parents that I work with is that you have got the amount of energy that you're going to expend in any circumstance, right? Normally, the energy is on the back end when we're dealing with the behavior that we don't like, the meltdown, the disrespect, whatever. Like, there's so much energy we waste. Or that's just where we're spending it. But if you can put the energy on the front end of a situation, plan ahead, think ahead to where the triggers are going to be, where you're going to have trouble, and address that ahead of time, either with a plan or with a conversation or whatever it is, then it makes room for connection. It makes room for enjoyment as well. And that is, of course, for any child. So I love what you're saying here. And I love that you don't just have, the what, it's the how. And that's what we need. Like, please just tell me what I need to do because I'm willing to do it. I know parents are so willing to do what needs to be done for their child. And I love your message and I love what you're saying. And your message is a message of hope. Your message is one of, what, our kids are our kids. We need to accept that what is, and know that there's things we can do to give them a life where they can thrive as best as they can. Right. And your son, you said, still does need a lot of care. And he also still has skills that he wouldn't have had you not, completely dedicated your life to this work. Right. So
right. And everything can be broken down and new skills can be taught. And the goal is really just to keep him safe, independent, happy. We had to figure out how to get him a COVID test, how to have him wear a mask. Like, there's always new skills.
Yes. That's great.
And the other big message, which I think it will really resonate with you and your audience, Robbin, is that in my book, I talk about the parent, especially one parent, becoming the captain of the ship. So that what professionals you need, how to talk to professionals. There's some people in my online course now that are posting like the behavior analyst came over or the therapist came over and she's like, how do you know this stuff? Like, how do you know what to ask? Or how do you know what a man versus attack is? And, and they're like, oh, I'm taking Mary Barbera's course. And then, but it's like, I want parents, you shouldn't have to be a registered nurse and a behavior analyst. I felt like, as Lucas was growing older, I'd have my pharmacist hat on, I'd have my advocate hat on, I'd have my registered nurse hat on. I want to empower parents, even if they don't have the background, to know what to do, who you need in place, what professionals are going to be helpful, and really create a movement to change the way autism is detected and treated, and to really empower the parents, because like you said, there is always hope that things can get better and that your life can be a happy one.
Yeah. Oh, what a beautiful message of hope. I love that. And for any parents that are listening who are in the trenches, please make sure you take time to take care of yourself because it is exhausting. It is overwhelming. It is above our pay grade as a parent. I mean, it is tough. It's hard enough to raise a typical child, never mind a child with extra needs and special needs. And, Mary, you and I are the same in that we both have kids with extra needs and we've both dedicated our lives to helping other parents. So, I mean, I think it's a pretty special thing. And I just want to thank you so much. We're going to share all of the information about your book and your website. You have graciously given the listeners, through my own site, a copy of the first chapter of your book, which is going to be great. So we all have that to look forward to as well. Thank you for being here. I don't think this is the only time we'll talk because this is an important issue that we need to continue to talk about, learn about, to give ourselves and our kids hope. This is really important. Thank you so much for being here. Dr. Mary Barbera, you are wonderful. The book is Turn Autism Around, and you can go to turnautismaround.com and find everything you need to know about Mary and her book. Thank you again for being here.
Thank you, Robbin. It's been great chatting with you. So look forward to many more years of collaboration. Thank you.
Thank you for listening to this edition of my podcast, Parenting Our Future. I'm parent coach Robbin McManne, and if you're enjoying this podcast, please share it with someone who you think might also need to hear this message. And don't forget to subscribe, and if you like my work, I'd be grateful if you gave me a 5-star rating. For those of you who like my content and want more, visit me at yellingcurebook.com to get your copy of my book and to find other resources to help you. Until next time, I am wishing you and your family peace and connection.